Hi, so my name is Jake Darling and I'm going to be demonstrating an intramuscular injection today. So you just follow me to the med room, we'll get started. We'll review our physician's orders for today's date of February 7th, 2021, time of 16:35. Just set this off to the side. So now we're going to compare our physician's order sheet with our MAR. So, right patient, nursing Jake, VIN number 312-312-654-654-987-987. Date of birth, January 1st, 1960. January 1st, 1960. Patient has no known allergies. There is a transcriber and a reviewer on the physician's order sheet, as well as there's 2 transcribers for each medication on the medication administration record. So we'll get right into it. So right medication on Danzatron, right dose 6 milligrams, right route, intramuscular, right time and frequency is daily. Before supper for 1700 is currently 16:35, so that is safe to administer that medication today. Next we have heparin, right medication, heparin, right dose 5,000 units, right route subcutaneously, and right time and frequency is daily for 0800. It is currently 16:35, so that medication has already been given. So, and it's important to note that we're giving the Danzatron today because the patient has uncontrolled nausea and vomiting related to their chemotherapy treatments. Okay, so we will just set that off to the side. So firstly, we're going to review our parenteral drug monograph on Danzatron. So it's important that, it's 4 to 8 milligrams and can be given intramuscularly every 8 to 12 hours. We're giving 6 milligrams, so that's a safe dose. Additionally, the medication needs to be undiluted, so we'll be doing that. And some potential hazards to note are dizziness, headache, fatigue, drowsiness, and constipation. Okay, so put that to the side. So now we're just going to wash our hands, and we're going to get our medication. So this is our Danzatron. So it's 2 milligrams per 1 ml. I need 6 milligrams, so I need 3 ml. It's a 4 ml container, so any excess, because it is a single-use vial, will just be going into the med waste when I'm done. And the expiration date is good. And then we're going to gather up the rest of our supplies. So we have our 3 ml syringe. We have our blunt fill needle, as well as I'm going to be using a 23 gauge 1-inch needle. That is an appropriate needle size for an intramuscular injection. Okay, so now I'm just going to do hand hygiene again, and we'll get started. So open up this. We'll just say that's our garbage. We get our blunt fill. Wing goes back, maintain sterility. I'll go in the garbage also. Now I'll drop 3 mLs of air because that's how much I'm going to be drawing up from the vial itself. So I'm going to inject that into the vial prior. Okay, so now we'll have that ready. I'm going to get an alcohol swab and that garbage to clean the top of the vial for 30 seconds in a circular motion. We'll just say that's been 30 seconds. So in the garbage with that. So now we'll uncap this into the container, and then we'll inject all of the air. Now we'll turn it upside down, and we'll pull the needles to make sure we're in the solution the whole time, and gently let gravity fill up the syringe rather. I need to grab 3 mLs, and we'll just go a little over, just to make sure. There we go. And then we'll pull back, make sure there's none in the needle itself. Then we're going to cap that. And because I've already pulled it back, I can remove this. That'd go into my sharps container. We'll just say that's my sharps container. And we're going to butterfly these back to maintain sterility. And put that in the garbage. And so now I'm going to knock out my bubbles I have here. And now over top of my med waste, I'm just going to get rid of any extra medication I don't need. Right, and prime my needle. Make sure there's no bubbles. There we go. Got no bubbles. Good to go. So now we're just gonna safely scoop that up and cap it. I can just cap that like that. That's safe to do so. I'm not gonna poke myself. So now I'm going to do up my med label immediately. So for right patient of nursing Jake, drug name ondansetron. Dose is 6 milligrams, and this is going to be in intramuscular. Volume is 3 ml because the concentration is 2 milligrams per 1 ml. Date and time is 16:35 for February 7th, 2021. And MSN2. So now the garbage, attach that to there. There we go. So now I'm going to do my second check. So right patient, nursing Jake, right medication, ondansetron. Right dose is 6 milligrams. It's 2 milligrams per 1 ml, so that's why to get 6 milligrams, I have 3 ml. I have 3 ml. It's a little smudged, but you can see it right there. Okay, and so right route is intramuscular. It can be, as I've checked my drug monograph, doesn't state on here, but on my drug monograph, it can be given intramuscularly. And right time frequency is daily. Before supper, patient hasn't eaten, and it's for 1700 and it's 16:35, so it's safe to administer it. Okay, so now I'm going to put the rest of this into the med waste. I'm going to gather up my supplies. So I'm going to get my gloves, this, my pen, grab a 2x2, grab an alcohol swab to clean the site with. And now I'm gonna walk into my patient's room. So I'm gonna do my entrance. I'm gonna do my entrance safety check. So no, there's no hazards on the floor. Patients in no distress. I'm gonna set my stuff. So I'm gonna introduce myself. Hi, my name is Jake Darling. I'm a student nurse at the University of Manitoba. I'm gonna be administering your medication for you today. As a formality, can I get you to state your full name and date of birth for me, please? Nursing Jake, January 1st, 1960. Okay, great. And do you have any allergies? All right, that's what I have with here. I'm just going to compare that with your wristband. Nursing Jake, VIN number 312-312-654-654-987-987. Okay, great. So now, in a clinical setting, I would actually raise the bed up to appropriate height for working height for me. I'd have the patient raise the head of the bed up, and so now then I would and then I'd explain the procedure to the patient. But before I do that, I'm just going to perform my have the patient bear with me while I perform my third check. So now. So right patient, nursing Jake, right medication, ondansetron, right dose, 6 milligrams. Concentration is 2 milligrams per 1 ml, that's why I have 3 ml. Right route is intramuscular, and right time frequency is daily. For 1700 is 16:35, it is safe to give. So now I'm going to do some patient education. So the medication I'm administering for you today is an antiemetic called ondansetron. It'll help, an antiemetic will help with your nausea, relieve your nausea and vomiting. So I've assessed you for a history of hypersensitivity, as well as checked your hepatic function. You're good to go there. Some common side effects include headache, dizziness, fatigue, and syncope. And syncope is like passing out. in case you weren't aware. Some education some patient education that and information you should be aware of is that you should increase your hydration. So you should be drinking 8 to 10 glasses at least per day while on this medication, as well as increasing your intake of foods that contain fiber. And it's also important that you do not ambulate carefully, as I've said, this medication is a risk for causing you to be dizzy, and the side effects causing you to be dizzy and of syncope. So are you okay with me administering this medication for you today? Okay, great, awesome, thank you. So now I'm going to perform hand hygiene, and I'm going to just landmark where I'm going to go, and so the patient knows. So I'm going to be giving this into your muscle. This will be done, I'm going to be doing it in your vastus lateralis. So to landmark, have one hand on your greater trochanter, the other one just above the knee, and I go halfway in between those, so right here. So now I'm just going to hand hygiene. I'm going to put on my gloves. And now we're gonna pretend that this is the vastus lateralis, and I've already landmarked, so get this on the road. My glove is backwards. Okay, so we'll get this open and ready. And I can put that back there on your wrist where it belongs. So now I can just go in the garbage. So now I'm gonna clean the site in a circular motion for 30 seconds. We'll pretend that's been 30 seconds. I'm gonna leave that there just so I have an actual reference for myself. So now, and also, it is important that in my facility, we do not aspirate for doing intramuscular injections, as per hospital policy. So now I'm gonna do this. So I've already landmarked. So I'm gonna displace the tissue. So hand down like this, displace it, pull it out of the way, and then go straight in on a 90-degree angle. And to stabilize, slowly inject the medication. Okay, so I'm gonna leave it for a couple seconds, pull out gently, and I'm gonna quickly set that to the side without poking myself, give the patient to apply pressure with this to prevent any bruising. So patient will apply the pressure. I would cap my needle immediately while using the safety. For this purpose, I am not going to, as I need to use this needle for practice purposes. So, but I would dispose of it into the sharps container. So now I would remove my gloves. I would put those into the garbage can. I'd perform hand hygiene. So now I'm gonna let the patient know I'm gonna be continuing to monitor for the resolution of their infection, and that they're maintaining adequate hydration of 8 to 10 glasses of water per day, and increased their intake of bulk forming foods, so fiber-rich foods, and as well as for the resolution of their for their nausea and vomiting. So is there anything else I can do for you while I'm still here? No? Okay, great. So I'm going to put the call bells within reach, beds in lowest position, arm rails are up, patients in no distress, and I'm going to gather up my stuff. But before I leave, I am going to sign my MAR. So I'm going to sign UMSN2, and for the time I gave it, for 1635. Okay, great. So now I can complete my exit safety check. I said before, patients in no distress, beds in lowest position, call bells within reach, arm rails are up, and end scene.